Thank you very much, Russ. And we are here at the Live Well Exercise Clinic, and we're not even calling it a gym because everyone in here is receiving some sort of medical care. In fact, exercise, a part of their prescription. Coming up next, Jody and Riaz, we will go through a stress test. Live Well Exercise Clinic, and the interesting thing about this place actually is everyone here is under the supervision of a medical professional, right, Sarah?
Yes, yes. And everybody here we're with Dan, who's doing a submax stress test on the treadmill. Every single person here has either diabetes, heart disease, or obesity. Dan himself has diabetes, and so today we're doing a treadmill test to see where we can be at with Dan for his exercise program. So, Dan, today we're going to have you walking on the treadmill for us, and every 3 minutes we're going to make it a little bit more difficult. And the purpose in that is that we want to see not only how your heart rate and blood pressure react to exercise and respond, but also how they recover after exercise.
So what kinds of things are you looking for? You obviously don't want, you want to make sure he's not suffering from any kind of pain,
Absolutely.
Right? That's got to be key.
We want to make sure that Dan isn't having any symptoms, and if Dan had any symptoms, and as he was referred here by his physician, as everybody at the clinic, we would be referring back to Dan's physician any symptoms that Dan would have for follow-up by his doctor.
And so it's interesting to kind of set up a clinic like this where essentially most people are sort of just go to a gym. How is this different when you kind of have a situation where someone has gone to a doctor because they have one of those 3 types of diseases?
Yeah, so someone can go to their doctor and they have one of either obesity, diabetes, or heart disease, and they may be looking for more support in how can they be more active, how can they lead a healthier life. And there is a lack of resources in the communities, and so this is a resource for people to come to where they have healthcare professionals who are working with them at the clinic in exercise, nutrition, lifestyle management to help them get healthier.
Basically, they're getting a prescription, Jody and Riaz, to get healthy. It's all about living well. Again, here at the Exercise Clinic. Throughout the morning, we're going to learn a little bit about how certain exercises, I guess, are beneficial to people that have diabetes, specifically how their body reacts to certain exercises and that type of stuff. So for more details, of course, you can go to their website. But what a great program, don't you agree? Here at Live Well Exercise Clinic, where exercise is medicine, and everyone here, by the way, under the supervision of a medical professional, also either diabetic, has heart disease, or is obese. And we're going to focus now on diabetics, right?
Yes, and I think it's really important to know that being active with diabetes is one of the most important things in terms of treatment for diabetes. It's important to get out and walk. It's important to be active. Another important point is resistance training. So using either resistance bands or weights like Carolyn's using today.
What specifically about resistance training is important for the diabetic specifically?
Resistance training is actually in the guidelines now for diabetes and exercise, and the reason is that resistance training actually helps to improve and increase our muscle mass. And as we increase our muscle mass, exercise has an insulin-like effect, which means that exercise helps to lower our blood sugars or our blood glucose. Resistance training, increasing the muscle mass, we're now actually helping to lower our blood glucose more over the long term.
And what I love is that this isn't just about vanity. Clearly, Caroline, you're doing a great job on those bicep curls. Isn't she doing a great job? Having medical supervision, specifically with the people with the 3, I guess, diseases that we're talking about.
Absolutely.
So for anyone that's a diabetic that is looking to exercise for the first time and getting into a program, what's really important? And of course, you are a doctor, so you know.
Yeah, you know, I think obviously talking to your doctor, making sure you're safe to exercise. Number 2, picking a physical activity that doesn't have huge limitations for you. So, you know, you're a diabetic with bad knees, taking up running, not a good idea. Starting slow is a good one. And then important, especially if you're a diabetic, for example, on insulin, is bringing your glucometer to the gym or the exercise facility and checking your sugars before and after exercise to make sure you're in a safe range to exercise.
Excellent. Well, for more details on the Live Well Exercise Clinic, and Jody and Riaz, by the way, the medical professionals are here to continue on with the health, so it's not just set them up with a program and then forget about them. There is the opportunity to continue to monitor and see the progress of someone with any of those 3 diseases. Coming up next, we'll focus on either heart disease or obesity, and that's coming up just after 8 o'clock. We're here at the Live Well Exercise Clinic, where exercise is actually medicine. We focused earlier on the importance of exercise for diabetics. Other patients that you treat here and actually prescribe exercise for are people with obesity, right?
Absolutely. It's interesting because I think people think exercise plays a huge role in weight loss, and in fact, unfortunately, not the case. It's about 10% of the overall weight loss picture. But as I tell my patients like Nicole, we don't exercise for weight loss. We exercise to improve our muscle mass, while we're losing weight. And we exercise more importantly for the whole, get religion behavioral change.
Are you looking for a religious experience, Nicole?
Absolutely.
So what if
Amen.
So, but people would think that, when it comes down to exercise, that's going to be the magic cure for weight loss, and especially for somebody who's got to lose significant weight.
So a huge interesting thing is Nicole's been on this treadmill now for, actually an hour and a bit, and she's burned in that period of time. She's done 22 calories in the last 6 minutes. So in an hour, she's going to burn 220 calories. That's 2 pieces of bread. That's it. And I think the key here to remember is not a calories in, calories out, that exercise is going to help with the weight loss. But what it's going to do is, 1, improve her muscle mass while she loses the weight. And more importantly, there's really amazing studies that show that someone who exercises, their head's in the game. They feel like they're doing, think about it, when you're talking about weight loss, you're talking about restricting yourself and all about what you can't do. This is a woman who knows what she can do now.
You can do it, right, Nicole?
Absolutely.
She can do it, that's right. It's so important, again, to continue to exercise, but like you said, don't necessarily worry so much about the vanity of it. For more details on the Live Well Exercise Clinic, you can go to their website. We are here at the Live Well Exercise Clinic, where everyone here is being medically supervised, whether you have diabetes, whether you are suffering from obesity, and now we are dealing with, again, heart disease, right, Sarah?
Yeah. So here we have John on a bike, and John is working in his target heart rate zone. And it's very important for people with heart disease to work within a target heart rate zone, because that's where they're going to see the most benefit for their heart.
Okay, but when you talk about target heart rate zone, we've all been on the treadmill where you go, okay, here's my age, here's what my, I should be at 60% or 80%. Is it a little bit different when you're dealing with somebody who has a disease?
Absolutely. A target heart rate zone, or even a maximal heart rate, is something that is individualized for a person and should be tested. And there's different ways that we can test people for that, the most accurate way being a treadmill test. And so what we did earlier today is the most accurate way, and John is now working within his prescribed target heart rate zone.
Okay, so are we dealing, obviously when we're dealing with people that have heart disease or maybe have had a heart attack, is this considered kind of rehabilitative, kind of what they would have maybe like at a hospital kind of thing?
Absolutely, and this does not diminish the amazing cardiac rehab programs that exist in the city, but unfortunately most of the programs go 18 weeks, maybe 24 at the most. And so a guy like John, who's been through either a 4 or 6 month program, where does he go from there? Does he just transition alone into a community, or does he come to a place like this where he still gets the support, he still gets the supervision, and most importantly, he even gets adjustments of his medications, monitoring his risk factors, blood pressure, cholesterol, etc. And I find that it also creates a beautiful community-based experience for John, that he can interact with other people exactly like him as well.
Yeah, because people aren't coming here necessarily to get buff. They're coming here because they all suffer from some sort of disease of the 3 that you have, and they get a chance to support each other as well.
Yeah, you're coming here to train for your 80s, basically. This is training for your 80s and 90s, and I think everyone here understands that. And it's a beautiful community program that really keeps people involved. The interesting thing is the studies show that your adherence to a program is actually most dependent on your relationship with the people in the program.
Excellent. Well, if you want to learn more about the Live Well Exercise Clinic, you can go to their website, where exercise is your prescription for health.